Hi, everybody. It's Dr. Patricia Coughlin. And once again, I'm responding to a request by a subscriber who wants to understand the phenomenon of panic disorder and how to treat it. So, before we get into the how, we have to think about the why. Why would a patient end up panicking? What are the underlying mechanisms rendering the person vulnerable to this sudden and rather intense surge of anxiety, which feels like panic? In my experience, these folks tend to be highly avoidant. They avoid situations that evoke uncomfortable feelings. Not only do they avoid their intense anxiety provoking feelings, but they also avoid, ignore, dismiss the experience of anxiety. So, what that means is they're not aware of feelings and anxiety at low to moderate levels. So, these things are getting activated, they're building, but the patient is ignoring them, stuffing them, dismissing them, and so on. So, this builds up, making the panic inevitable. And because they're so avoidant and detached from their emotional experience, when you begin to inquire about what triggered these episodes, they're often clueless about it, or they'll say it comes out of nowhere, or they'll attribute it to some external event, like my professor was really critical and tough with me, and I'm really panicked about my grades. So you are going to have to help them identify the emotional triggers. When someone says, I don't know, or there really isn't any, they just come out of the blue. You don't just accept that, and sit there stymied, right? You begin to inquire and, take on that sort of Columbo mentality of digging for details. So just like with depression, people who have episodes of depression, because often they'll say also comes out of the blue, I don't know. You're going to start with tell me about the first, the worst, and or the most recent, so that you can really start to dig in what was happening at that time, what was going on. And then once you're able to identify what was happening right before the panic erupted, you can begin to inquire about feelings going on, because it's inevitably in some kind of conflictual situation, right, that's bringing up a lot of anxiety provoking feelings. So you do have to dig around for those specific episodes, what was happening, and then begin to look at the feelings getting generated toward the people in that scenario. Very much keeping your eye on anxiety as you're pressing for feeling. And again, often these folks are really unaware of their anxiety at lower levels. So you're going to see it. They're giggling nervously, fidgeting, sighing, various signs of anxiety. And you might ask, I wonder how you're feeling right now. They might even say fine or whatever. And you might have to point out, it actually looks to me like you're anxious. Are you aware of that? I mean, you laugh, but it's not really funny. Was that a nervous laugh? So you're actually going to have to help them pay attention to anxiety at lower levels, and then begin to wonder about what kinds of feelings and thoughts and fantasies are stimulating those feelings. So I hope this is helpful to you. Um, Again, it's not really that complicated, and you don't have to panic yourself if the patient starts. I've certainly had this happen in my office. As you're pressing for feeling, the patient will start to hyperventilate, right, or really start to have some panic symptoms. So you have interventions, right, that can help to bring that down very rapidly. You immediately take your foot off the gas, right? It's pressing to feeling that's stimulating that anxiety. If anxiety is too high, you immediately get off that. You don't talk about feelings, you just focus 100% of your attention on the experience of anxiety. Looks like you're super anxious right now. Let's see if we can bring that down, right? Let's see if we can slow your breathing. Do not sit there silently when someone starts to panic. You really want to talk, intervene, keep them with you, bring it down. Wow, your anxiety is really high. Let's see if we can bring that down for you. Okay, and so I hope this helps. So let me know. Get back to me with questions, comments, and we'll continue our conversation. Thanks.